First News with Keeler in the morning on WIBX and WIBX950.com.
Dr. Ken Hall standing by on the line right now. Doc, good morning. Do I have him here? I don't. Doc, can you hear me?
Yep, I got you.
Got you here.
Decoration Day was actually called Decoration Day because it was a day that people should go out and decorate the grave sites of those that fell during the Civil War.
Right. Well, that was tomorrow's question.
Sorry.
No, it wasn't. It wasn't really. I'm busting your chops.
Again, he's got an answer for everything.
You do.
That we throw at him.
Well beyond the medical realm.
But so. You know what I thought of? The first thought I had was what I assumed it was they would say he was a very decorated soldier or a decorated general. That was the correlation my mind made, but it's good to know what the real answer is.
That's really cool. Okay, Doc, let's start by, it's been a few days, and I know that you've been in and out, but we are looking at outdoor weather, and I know the next couple of days are going to be tricky, but after that, the weekend not looking all that bad. And as we are more outdoors, the numbers continue to go down. That, of course, combined with the fact that we're about 60-some-odd% vaccinated in this area.
Yeah, so those are all good things. I will say, so yesterday morning, we had 14 people in the Mohawk Valley Health System that were admitted for COVID. And, unlike last year where the average age was, 70-plus, now we're seeing people in their late 30s and 40s and people that do not necessarily have significant comorbidities. So I think that that's an indication of two things. Number one, that the vaccines have worked because the vulnerable population is the population that we targeted very early on and very strongly to really try and protect them. But number two is that this virus is still around, and getting your vaccine, even though you're young and you are healthy, and you say, well, I'm not really in danger. That's not true. There are, like I said, there are people in their 30s and 40s here that are in the hospital because of this disease. So continuing to look for and get vaccinated is really important for the individual, and it's important for the community.
Doc, I find something interesting here, and we talked about these numbers earlier. I know this is a small snapshot. Okay, so the last 3 days of reporting for Oneida County, just a total of 21 new cases. That's great news. But as I look here at ocgov.net, I see this is just county residents, Oneida County residents, 19 hospitalized, 9 of them in the ICU, and the county's active case total is 150. So I'm just surprised that hospitalization and ICU numbers so large when numbers have fallen as they have, and the active case total you can see is down under, it's almost under 150
is a good number.
Yeah, so the active cases relates to, that I think goes toward people who are having minimal symptoms. And I think that we have probably gone away a little bit from actually doing significant testing on people that have minimal symptoms.
Okay.
So that may be an artificially low number. Mm-hmm. The other thing that I would say is that for the people that have gotten vaccinated, that they continue to be protected from severe disease. The people that have not, obviously, are not protected, and those are the ones that we're going to see coming into the hospital.
All right.
Just a follow-up to that. You're right, it could be artificially low, but as a percentage of active cases in Oneida County, almost 15% of those cases are in the hospital. That's a huge number.
Yeah.
So anyway, but you're right, it's probably larger than that, but fewer are now getting tested.
What do you say to someone like Rand Paul who has said he will not get vaccinated?
So I don't understand why Senator Paul would not get vaccinated. I don't understand the thought process behind it. And obviously I haven't spoken to him, so I don't know. And I haven't read a lot of media reports about what his explanations are. But I would say that if you're saying that as an example because you got the disease, then we know that the vaccination actually gives a higher antibody level, and as far as we know, a more sustained antibody levels. So those two things would say, that vaccination would be good. Why? I would ask the counter question: why would you not get vaccinated?
Yeah. Especially with the success that it seems to be having right now.
Dr. Hall, Rand Paul's statement on an interview that he did. This is a quote. He says, "Until they show me evidence that people who have already," because he had COVID-19, Senator Paul had COVID-19. He said, "Until they show me evidence that people who have already had the infection are dying in large numbers or being hospitalized or getting very sick, I just made my own personal decision that I'm not getting vaccinated because I've already had the disease,
saying he has the
and I
antibodies.
have natural immunity."
Which, by the way, they came out that if that natural immunity does exist, the latest is saying that it lasts at least the antibodies last at least 10 months. That we're learning now. That's at least not
for the vaccine.
But no, antibodies for people who've had the virus. Did you see that, Doc?
Yeah, I did, and that is good. And so if his explanation is that, I had the disease and therefore I am already immune, then, okay, that is a reasonable argument and explanation. If he's saying that he's doing it because it is his personal choice and it is his right to make that choice, that's absolutely true, and I fully support that. I would go back to what I said earlier, which is that we do know that the vaccine actually provides a higher level of antibodies. So then it just becomes kind of a judgment call. I can't speak to evidence because evidence, if it exists, it is still in its formative stages about whether vaccines are ultimately better than the natural disease or not. There is theoretical and a little bit of science related to that says that they seem to be, and that's all based on antibody levels, but it's not based on people actually getting the disease. And I think that may be what Senator Paul is looking for.
You have been vaccinated?
I have been, yes.
And when you walk into a grocery store, you walk into a convenience store, the sign says you've been vaccinated. You do not need to wear a mask. Do you wear your mask in?
So I continue to wear my mask when I'm in enclosed spaces with other people, and I do that for a couple reasons. Number one, I do it because I think it sets an example. Number two, I do it because I want other people to feel comfortable around me. And number three, I do it because while I have been vaccinated, I presume that my body, manifested an antibody response to it, but I don't know that for sure. And so it is safer for me, especially when we're only at 55-60% vaccination across the community, that I take that caution.
Doc, on the issue of the 10 months of antibodies, if you've been infected and your body has fought this off, is there an idea or a theory as to what percentage of those who were sick have the antibodies for 10 months? Because we hear stories about people who say, whether it was 6 months in between or 2 months in between, that they've gotten it and, they've gotten it again. So is it that the virus is just testing positive again? Or do we know what percentage of people, once they're sick, are protected for at least 10 months?
So I haven't seen that data to say, what is the percentage, but I think you're exactly right. Each person is an individual, and so some people, may please don't take this to the bank, are going to be immune forever because they got sick, and that's the way that their body responded, and it's going to continue to respond that way forever. Others may get sick and then respond very quickly, and their immune system says, okay, that's done, and now I'm going to forget about it. Everybody is a little different. And another reason why, while I support what Dr. and Senator Paul says from an individual choice standpoint, I would say that from a caution standpoint, getting the vaccine, even if you have had the native disease, would provide an extra level of benefit that you are not currently getting.
I want to throw just quickly at you today. today I believe the Liquor Authority is having one of their meetings. I'm on the alert list, so when they meet, I get an alert and I watch those to see what they're going to do because it affects bars and restaurants. It affects venues that do wedding receptions and that sort of thing. And based on what the state is requiring, I think you're going to see at least the Liquor Authority adopt what the state is recommending right now, and that is if you're a business, the limits are 250 and 100 outdoors. But if you're vaccinated, you do not have to wear a mask. You do not have to socially distance. That I find very interesting. Also, for arenas and sporting events, catering halls, etc., business capacity is only limited by the space available. So non-vaccinated people still need to wear masks and still need to social distance. Vaccinated people do not. No masks required. They're optional. The other thing is if you have a young child and you are vaccinated but the child is not eligible yet, the child can sit with vaccinated people. You can have your kid with you, and they don't have to wear a mask. I find that to be pretty interesting. And oh, by the way, you can use the Excelsior system, proving they've been vaccinated, or the honor system. That kind of leaves it wide open, don't you think?
It does, and it's the very last part. It's using the honor system, which makes it a little problematic. Only because if we're talking, if you think about this as a herd immunity question, then you can say if you are dealing with a population of people, all of whom have been vaccinated, and let's say there's a 5% failure rate, okay, so 95% of those people are now immune. You have achieved herd immunity. Even if one person in there is actually infected, the chance of spreading it to anybody is so small that basically, because there is no target for the virus to get to. And so that's what herd immunity is. Whereas with the other population, who have not been vaccinated, and some of them have had the disease, so they may have, say, 40% are immune. There's a lot of people within that group that the virus can attack, and therefore you want to protect the population there, that 60% that is still vulnerable. And so that's where that comes from. And even if you add kids to this, that's a relatively small percentage of the total population. So it may take that 95% and bring it down to 85%, but that still gives you that herd immunity bubble in terms of the virus doesn't have that many targets to look for, and so the odds of it finding somebody are very low.
All right.
You
have one more? Yeah.
No, I'm good.
Okay, yeah, just Dave and Alien asking an interesting question, I guess. Ask Dr. Hall, should a fully vaccinated person transport two unvaccinated people in your car from Herkimer to Yorkville round trip?
Not if you're going to Full Throttle Barbecue and you want to... I'm just kidding.
Well, you should require them to wear masks, I guess, if they're not vaccinated.
So I guess the issue is, should vaccinated people still try to actively avoid unvaccinated people?
Well, no, certainly not. If you are vaccinated, then you should be protected. Again, 5% or not, but in general, yes.
Yeah, you're the one that's protected. They're the ones
have issues with that.
Yeah, they're the ones that are vulnerable, right?
Correct.
So,
I would say that I would recommend that the people who are not vaccinated should be wearing masks.
Doc, we appreciate it. Sue, stand by. I'm going to get to you if you don't mind waiting through the news. I know you've been waiting, and I apologize. Doc, we appreciate it. Have a wonderful day and a great weekend.
Thank you, everybody. Please be safe.
Thanks so much.